This is Tom. Tom's here to have his teeth cleaned today. You can't see him very well just now. He's chilled out on my lap. Not all cats are particularly amenable to having their teeth brushed and such like. You can try their other options to help your dental hygiene in your cat. You can also try mouth washes, actually, that you can squirt into the mouth, and that also decreases the plaque adherence and the bacterial load. Another thing is there are special dental diets. Some of these usually have the biscuits are bigger and knobbly, and the cat actually has to really crunch them. And has the same effect, in essence, like a dog chewing on a bone. Also really worth remembering that cats' bites are really nasty, okay, or scratches. They can become really infected very easily. If you're worried about it, I would, be careful as to how you approach cleaning your cat's teeth, and if you do get bitten or scratched, to obviously seek medical advice. Okay. Dental disease is really common in cats. We see it a lot. It starts off with a build-up of plaque, which is a film that covers the tooth. It's made up of proteins and sugars and bacteria, and this can cause gingivitis, and gingivitis is inflammation of the gum. This in turn will destroy the ligament that actually holds the tooth in place, and obviously it's very painful as well. Okay, so plaque, if left, will eventually mineralise to form tartar, and this tartar will then lift the gum off the actual tooth and can really loosen the tooth, and they can fall out. Cats can also get viruses such as Kalichi virus, which will cause gingivitis, and that can contribute towards the dental disease as well. It's really important. You can vaccinate for viruses such as Kalichi virus, so it's important to speak to your vet as well. The biggest difficulty most owners tell me about is, how do I hold my cat to do that? Often cats are not particularly tolerant of having their teeth cleaned. So we have the same trouble with Tom. He's quite a fidget. It's handy also just to get him used to rubbing around his face, rubbing near his gums, opening his mouth, so that it's not such a stress for him, and eventually they will get used to it. So we've got him on the table here. Now it depends if you're right or left-handed. So normally if I'm going to open up a cat's mouth, I am right-handed. I use my left arm to hold him in place and to hold on to his head. If we grasp round the head and pick his head up, he can't bite us. It's a very good way of holding him, and it's not sore for him. It's not painful. And he'll soon get used to it. Head upwards. If they're really scrammy at that as well, and they want to nibble your fingers off, you can use a towel as an aid as well. And sometimes just by wrapping them up, you can help prevent the claws coming out. So just lay the towel out on the table, plonk your cat on, and we're going to make a cat sausage roll in essence. So try and hold his feet down here with one hand and keep your body pressed on his back, and this stops him shuffling away the other side. You want to bring one end up. Oi, mister. Hold him tight. Oi. And then bring the other end up as well, obviously keeping his head out the way. That's you, sausage. And you can hold the towel and obviously hold the cat, and this helps restrain all the claws and such like that. He's not got so many feet out. It's really important to keep this part tight, and it stops some of the front feet jumping out, okay? From here then, we've got really nice and easy access to the teeth, okay? And we can just part his gums and have a wee look here. We have a few different toothbrushes. So I've got a kiddie's toothbrush. This is one that's suitable for dogs, but also has a very small head on it for cats. And there's a nice angle to this that can make it a little bit easier. So I'm going to try this one today. And I've been a bad owner, and Tom hasn't actually had his teeth cleaned very regularly. He doesn't like it very much, but we are trying to avoid him having to go in for a dental. Sometimes when there's tartar is really bad, you actually have to go under anaesthetic to have a descale and polish, because the brushing alone might not help. Okay, so I've popped my toothpaste on the toothbrush here, and normally I sit them on the table or sit them on your lap. So we can actually see with Tom's gnashes here, they're nice and clean. He's got a very mild bit of tartar formation on his back left upper molar there. but everything else is fairly pearly white, but there will still be plaque there, and if left that plaque will become tartar. So I've got my toothbrush here and just very gently start massaging. Oh, and try and go around all the teeth. Good lad. Give him a little break if he's getting distressed. Lots of encouragement. If afterwards you might get a biscuit. There we are, so we'll start with the side. Even if you only manage maybe a side a night, it's going to all help and contribute. There we are. Just round circular motions, gently covering every single tooth.